Welcome back. During the month of October, patients are sharing their stories to educate women about the disease and the importance of early detection when it comes to breast cancer. Reporter Naomi Ruckham introduces us to a woman being treated for triple-negative breast cancer, which is more common in Black women.
Renee Williams gets mammograms and does self-exams with her family history of breast cancer. Earlier this year, the 52-year-old felt a lump.
My mom passed away from breast cancer when I was 5 years old. I always had a feeling that either me or my sisters, one of us would end up with it, and it ended up being me.
Renee was diagnosed with triple-negative breast cancer. The aggressive cancer is more common in women under 40 who are Black or who have a BRCA1 mutation. The cancers are more likely to come back after treatment and have a poorer outlook than other breast cancers.
Triple-negative breast cancer is a very scary diagnosis, but it does sound like there's hope.
Yes, absolutely. So
Dr. Sylvia Adams with NYU Langone Health says adding immunotherapy to the standard chemotherapy is a major advance in treatment for patients, including Renee.
We actually had a very early good clinical response and were able to take her to surgery earlier, and she had no residual cancer at time of surgery, which predicts an excellent outcome and cure.
For patients with early disease, clinical trials are underway to better tailor treatments.
Make sure that patients have less side effects from the chemotherapy. Maybe we can do less chemotherapy in some patients.
I don't care what diagnosis you get. That doesn't mean it's a death sentence.
Renee wants women to know early detection is critical.
Sometimes you won't feel it. Go and get your mammograms.
The mother and grandmother is starting radiation. She's back at work as an oncology clerk and grateful to help others going through what she has. Naomi Ruckham, CBS News, New York.
The American Cancer Society estimates nearly 288,000 new breast cancer cases will be diagnosed in women this year. Triple-negative breast cancer accounts for 10 to 15% of all breast cancers. Walmart is helping people with hearing problems. The retail giant announcing that it is selling over-the-counter hearing aids for the first time in company history. These devices can be purchased without a medical exam by a doctor or a prescription. And they come in the aftermath of the Food and Drug Administration's new rules regarding hearing aids. The FDA says their policy change will make hearing aids more accessible to the general public. Officials say that they'll be available to U.S. shoppers who are at least 18 years old with perceived audio issues, and they're going to cost between $199 to $999 per pair. Coming up next, the challenges that people are having when it comes to buying a home.